Hello, this is Siddharth Ambar. I am the physician here at Chicago Arthritis and Regenerative Medicine. The purpose of this video is to welcome you to the practice as well as give you some expectations of what to expect during your consultation with me when you come in. Before I do that, first and foremost, I'd like to express my gratitude and appreciation with you in your trust with me and my team when it comes to your health. I take that very seriously. We are here to help you improve your life and make things better for you. My focus as a professional is on maximizing and improving arthritis, tendonitis, back pain, injuries with the most up-to-date non-surgical treatments possible. I have a particular focus on treating inflammation as well as instability to help treat those musculoskeletal conditions. As part of your consultation process here, first and foremost, expect to get a lot of educational material from me and my team. I think the more educated you are in what are your treatment options and what's going on from your health standpoint, I think that gives you a better sense and chance of making some good decisions, as well as gives you a better chance of maximizing your outcome as well. As part of the consultation process, expect to have a very detailed history and physical examination from me personally. That's meant so that we can really get a good sense for what's going on with you, what are maybe other medical problems that could be contributing to your condition as well, and areas that we can improve things. Frequently, I'll also do a musculoskeletal ultrasound as well. The purpose of that is to help look at the soft tissue structures, the joint, the tendons, the ligaments, looking for inflammation, looking for structural issues as well, looking for instability as well. They help us guide in terms of how to make some best decisions in terms of your care. After all that's completed, I'll then be able to give you recommendations in terms of additional testing that may be required. I'll also be able to give you a better sense for what your diagnosis is, what's your condition, what are other relevant issues that should be treated as well. And based on that, I'll then be able to give you a better sense for what are your treatment options to treat your condition. With all that, you'll also get a good sense of what are expected outcomes with treatment, time course in terms of treatment, and of course, along the way, I'll be available to answer any questions that you may have. Part of my team's goal is to be able to connect with you and communicate with you in whatever way is best in terms of conveying our recommendations with you, whether that's in person, whether that's via phone, email, texting. We're available to communicate and help out in any way possible. But most of all, our goal is really to get you to feel better, to minimize pain, to improve function, to optimize your health as well. That's what me and my team are here to do. And as much as we can do that, we'll be able to offer our best care possible. I look forward to meeting soon. Thank you for your time. Have a good day and live well. Bye-bye.
So Ms. Eugen, thank you for helping Chicago Arthritis to do this testimonial. We really appreciate you taking time and doing this for us. So if I may start by asking for your name.
My name is Mary Eugen.
And if I may ask, please, your age.
I am 74.
Thank you for that information. So I have a few questions for you. What was your life like before your procedure? What were you unable to do that made you upset?
I was experiencing a meniscus tear in each of my knees. One was one that had been there for about 9 years, and then I had a more recent one which was combined with a displaced kneecap. And I, just prior to when I started the procedure, I could barely walk. And I am a flight attendant, fully employed, and it was very, very difficult.
Great, thank you for that information. And what kind of concerns did you have prior to the procedure?
What kind of what?
Concerns did you have prior to the procedure?
I don't know.
that you weren't able to do life-wise?
Well, I had tremendous difficulty walking prior to the procedures, and I had seen Dr. Tambar, who did a presentation at Whole Foods, I think the year prior, and I had gone there and I had carried his information around for a year, and I just knew I wanted to do the procedure, and I knew I didn't want to do surgery.
Awesome. So what was the procedure like, Ms. Eugen, for you? The experience and everything from start to end of the procedure. Can you tell us a little bit about that?
First of all, I went into it never thinking that it was not going to work. It didn't even occur to me that it was not going to be successful. And it was successful from minute one. At the time of my first 2 knee procedures, it was a 3-part procedure where the first procedure was PRP, and then a week later it was the stem cell bone marrow extraction and PRP injection, and then the third procedure was PRP. I think it has changed slightly since then, and with my knees I felt almost instant relief. Right. And my success with my knees has been 100%.
Oh, okay, great. So can you tell us a little bit, what is your life like now?
My knees are perfect. I have no pain whatsoever in my knees. And I have to say a good part of that has been the fact that I've been doing physical therapy constantly since the procedures. And I think that's a really key component of this whole procedure.
Okay, great. Thank you so much, Ms. Eugen. And one last question for you, please, if you don't mind. What would you tell someone considering Chicago arthritis for the procedures that we perform here?
First of all, I would say that Dr. Tambar is one of the finest human beings on the planet.
Thank you for that.
And he is so kind and so nice, and he tells you exactly what he's going to do before he does it. And he'll tell you it's going to be a pinch and a burn, and you know what? It's a pinch and a burn. And he's just so kind, and he's just the best. And I talk about him constantly, and because he's helped me so tremendously, and I'm thrilled that I've done this, and I would continue to do it for the rest of my life as long as I was told there would be hope for improvement. But I'm thrilled with the procedure.
Okay. Well, Ms. Eugen, thank you so much for your time, and we appreciate your testimonial. Thank you.